COVID-19 testing site, Route 22 at Hospital Drive. That's at Advocate Good Shepherd Hospital. It's 450 West Route 22. And Park Ridge, Dempster at Luther Lane at Advocate Lutheran General, COVID-19 testing. That's traffic. I'm Al Verdi on AM 560, The Answer.
Chicago's Morning Answer continues next in our 1 hour heating and air conditioning weather center. Very windy. Morning rain or snow showers have tapered off and moved on to the east. Cooler, though. Locally damaging winds through the afternoon and a high of 43. 36 right now. Next news coming up at 9. Breaking news as it happens. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by Secure Retirement Radio with host Raj Shah. Sunday mornings at 7 on AM 560, The Answer.
Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Top of the morning, Dan and Amy. Scott Gottlieb, former FDA director, was on with Margaret Brennan on Face the Nation yesterday. And he had this to say about what he believes is the extent of the herd immunity in the general populace in America. Significantly lower than what is being bandied about, even in the form of conjecture from CDC folks like Dr. Fauci.
Well, it may be widely available, but I think it's of marginal utility and impact for these kinds of discussions. What serology tells you is if you have circulating antibodies in your blood, if you've been exposed to the virus and you've developed some level of immunity. But I think when we actually do serology on the population, we're going to find the actual level of exposure across the population is very low, somewhere between maybe 2 or 5%, and I'd put it on the low end of that range. That's certainly the modeling and the data coming out of Europe, where they have anywhere from 2 to 5% of their populations exposed. If you look in certain professions, healthcare workers, police, people who work on grocery checkout lines, flight attendants, TSA agents, people who come in contact with a lot of people as part of their work, the rates may be higher, maybe on the order of 10% that have been exposed and developed some immunity. So you can make decisions in those professions to preferentially return certain people or put certain people on the front lines right away. But on the whole, we're going to find that a very small percentage of this population, certainly in the single digits, have actually been exposed to this infection. So the perception that there's 30 or 40% that have been exposed and develop immunity, it's not going to be the case.
Well, I don't know how he knows. And again, Fauci admitted when he said 25 to 50%, we don't know. He admitted he doesn't know. But we are getting some examples of this testing around the world. A team at the University of Bonn tested a randomized sample of 1,000 residents of the town of Gangelt in the northwest part of Germany, one of the epicenters of the outbreak. The study found that 2% of the population had the virus, and 14% were carrying antibodies, suggesting that they had already been infected, whether or not they had experienced any symptoms. It seems to me that these numbers are important because that's what the medical professional said. It's important to do the serological study to get a sense of what the herd immunity is, to start understanding what the potential downside would be if there was another viral outbreak, if you start sending people back to work, back to social distancing, but socializing in particular regions. And
but Governor Pritzker said if we don't have more testing, nothing's going to be opening up.
Well, he doesn't know what he's talking about. He doesn't even know the difference between a vaccine and a therapeutic.
No, he doesn't.
But they're just, I don't understand why these antibody tests are not online. I talked to a sales rep for ChemBio Diagnostics over the weekend. This is a company based in Long Island, publicly traded company. They have a antibody test. It's 15 minutes, needs to be administered by a medical professional. Yeah. They've got a letter from the FDA. They're waiting for their emergency use authorization. She tells me there's another handful of companies that have similar tests and that are competitors. That in the ChemBio test would tell you both if you're positive for COVID-19 as well as what your immunity level is. Not just if you
That's awesome.
not just if you had antibodies, but the level of immunization that you've achieved, the level of antibodies, which gives you a sense of just how immune you are, just what protection you have. So, and she said that they've had very little interaction with governments. And there are other companies too. They put out press releases about this. So why can't these things be brought online? Why can't we be doing representative sample testing simultaneous to the drive-through testing that's being done for the symptomatic and so forth, so we start to get the numbers that we need to make better informed decisions about reopening? I don't understand. And that's why we have Dr. Roger Klein to help us understand these things. He is both a medical doctor as well as a JD, expert with Regulatory Transparency Projects, FDA, a health working group. He's a former director of molecular oncology at the Cleveland Clinic, former advisor to all the alphabet soup agencies, FDA, CDC, CMS, HHS. Dr. Klein, thanks for joining us again. Appreciate it.
Yeah, hi, Dan. Hi, Amy. Thanks for having me.
Can you help clear up this issue of the antibody testing, how important they are? Is achieving herd immunity what we're trying to achieve, and don't we want to try and measure that just as quickly as we can?
Yeah, so it's a great question. And first of all, the antibody tests have a couple of purposes. There's a purpose in immediate patient management where you would, for example, find somebody who has antibodies, has therefore had exposure and, for example, got over an infection and is presumably immune and therefore probably not at risk of at least in the near-term future infections. And then there's the population level of looking at essentially exposure. And I think, so as far as herd immunity, I mean, Scott's right. It's probably lower than even 2%. I don't, you know what, the numbers of people in the United States who have been exposed to this outside of New York is probably quite low. And I don't, but I think that the reason the testing is important is because it gives us a handle on what the disease really is. We have many people, even though you've got to be honest, I mean, we've got a very small number of cases reported in the United States. And, you know, if 500,000 people might sound like a lot of people, but out of 330 million, it's not. But the numbers of people who are exposed is presumably significantly greater, especially in a place like New York. And what it will help us do is get a handle on how severe the illness is for most people, what's the real death rate, what's happening in different parts of the country, how prevalent is it, how because I think, you know, it's a very large country, both population-wise and geographically, and we need to probably manage the situation somewhat differently in different regions. It's very important, and there's studies online now. CDC's doing it, Stanford's doing it. There's other places there's a place in Colorado, and you read reports people are starting to do serology. It's very important. The death rates that we're seeing, the study you mentioned in Germany was 0.37%. Now that's very, very different than the 1% that people were telling us as a comforting level. It's much lower and more in the range of a bad flu.
But so then how do we make decisions about reopening?
Right.
Because Fauci is talking about, you know, we need to understand if we reopen and there's a rebound, then do we have the healthcare capacity and all these other questions? So how do you make that determination?
Yeah, so I mean, look, I'm a person. In my view, I think we need to be immediately looking at reopening in a safe and targeted manner. I don't even think it's a question. You know, you have two competing interests. You have economic models that are probably at least as valid as the epidemiologic ones that are talking about 20% unemployment and devastating millions of Americans' finances. So you have competing interests. There really aren't data to support the idea that we're going to be able to prevent deaths from this, or at least in a significant way, and could do so any better than protecting people at risk would do. We don't. The original justification was not overwhelming the health system. It wasn't that we were going to prevent ultimate death. If very few people are immune to this disease, and we don't have herd immunity here, I think that's clear. And this virus is contagious, and it has many asymptomatic people in Iceland. They're saying it's, and these are preliminary data, but they're saying half the people could be asymptomatic. That we're not going to be, we're going to have to learn to deal with this. But but the good thing is the death rate seems, according to Oxford Center for Evidence-Based Medicine, the infection rate is somewhere between 0.1 and 0.37%, which is really it's kind of a bad flu.
Well, yeah, and one of my physicians who works at Rush said the same thing. They said, Amy, this is going to end up being just a really bad flu. But what about counties that have no reported cases? Can't they go to school again? Can't they go to church? Can't they go to a restaurant? I mean, if they, especially don't let any other people into their county.
Well, I think not having any cases means that it doesn't necessarily mean there aren't any. It kind of means they weren't, they maybe haven't been tested, or at least infections, But I think I do agree. But what we need to do is we need to kind of move away from the former model. We need to be cautious. That's really, I think people are going to have to not get so close to each other. I think they're going to have to practice good hygiene. If you're sick, stay home. I was in the grocery store the other day, and there was a guy behind us, and look, he's far away, but he's coughing and coughing and coughing.
God.
Did this guy really belong in a grocery store?
No, I would have
I
slapped
don't know
him.
what he had.
Well, air slapped.
We need. Yeah. No, but I think that we have to be practical about this. It seems unlikely that it's going to entirely go away. It may abate over the summer. There may be a seasonal impact. But I think we're going to have to learn to live with this and deal with it, and that involves changing our behavior somewhat, but it doesn't involve abandoning our life.
The projections about the need for ventilators in New York seems to be off by about a factor of 7 or 8. Turns out that Trump was right, despite the criticism he received as questioning whether or not New York was going to need 40,000 ventilators. The number of hospitalizations is off by a factor of 8. Overshooting it. All of these models are overshooting. Is this all the result of all of the evasive actions that we're taking, and so we would argue for continuing to take them, or is there more to the story?
Well, people can argue that. It's hard to know. Look, in New York, you may have 6 or 8 people living in a very small space, and people have to go out of the house. It's pretty hard to avoid. It's hard to avoid other people. It's hard to do real social distancing for many people in New York. It's difficult to say whether it's the result of the measures. Mostly, we're talking about models that were imperfect, based on fallacious or not relevant data. They're really based on assumptions. The problem that we're facing and still face is people are treating models as if they're data or evidence, and they're not. Yeah. They're like a hypothesis. And I think so. From a planning standpoint, they're the best we have. Nothing wrong with planning for the worst. In fact, look, you need to be sure that you're taking care of people in the event really bad things happen. So I don't think planning is that. I think making decisions about people's lives is highly risky. It's extremely risky based on mathematical calculations that are not close to being the level of reliability of real data.
Do we even understand exactly what this how contagious this strain of virus is and its properties? I ask that because there's this couple of studies out of Austria, sample size of about 1,500 each. First, the random study finds about 0.3 of the population infected is infected versus the 8,500 confirmed cases at the time. So that's about 3x the number of confirmed cases. So this is sort of trying to get an extent of the infection. And the confirmed fatality rate is a little bit less than 100%, less than 1%. Austrian hospitals not overwhelmed with capacity. It's similar to Germany. And then there's this other test of healthcare workers and supermarket employees. This is before there were use masks sort of requirements in place. And no supermarket employees were infected. And one wonders if maybe the virus is contagious under some circumstances, but not under others. And so it's a little bit more complicated than just, being in close proximity to somebody for a passing moment.
Yeah, of course. So you're exactly right. And first of all, you're right. We don't have it well defined. But secondly, what I would say is that intuition is probably significant here. And what one would think is if somebody's coughing, sneezing, and spreading droplets all over the place, it's probably very contagious. So if we can get the sick people out of the way, we're gonna take it along part of the good part of the way towards stopping spread. But then you have the asymptomatic people or mildly symptomatic people who really aren't shedding the same level of viruses through coughing or sneezing, that sort of thing, but are still contagious. And that probably requires close and prolonged contact. So walking by somebody, you're not likely to get it. You're probably outside, probably more likely to get it from, say, touching surfaces and touching your nose than walking by somebody. That seems a very, very improbable. But in a place like New York that's extremely population dense, where you have lots of people in the same place and they have prolonged contact, and sure, many people are going to get it. And if you sit next to somebody on an airplane for 3 hours, that's it's probably relatively easy to get. But I don't think the asymptomatic population is spreading it as readily as we might think without prolonged and close contact.
He is Dr. Roger Klein. He's an expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, and former advisor to the FDA, the CDC, CMS, and HHS. Dr. Klein, thanks again for joining us. Appreciate it.
Thank you.
Thanks. We'll have you back soon. And he joined us on our turnkey.pro answer line.
Listen to Dan and Amy on your smartphone. Download the AM560 mobile app today at 560theanswer.com/mobile.
A beautiful and healthy landscape is always good for the spirit and to help brighten your days. But now, potentially more so than ever, your home is your refuge. And now is the time to make it everything you want it to be. The teams at AM Woodland Outdoor Design and Lots Custom Carpentry are working and taking every precaution for the safety of employees and customers. If you're stuck at home and thinking about projects, they'd love to meet in person, maintaining the recommended distance, or electronically to discuss ideas. Video chat apps have made it easy for consultations without any direct contact. In these unprecedented times, you can count on the AM Woodland and Lots Custom Carpentry teams to be there for you. Supporting a local family-owned business in times like these is very important, and they truly appreciate it and will continue to be there for our communities.
AM Woodland Outdoor Design and Lots Custom Carpentry, proudly serving Lake